Tonight on KGW News, where are the COVID tests? We check in on the national rollout and the local push to get at-home kits to those who need them. Plus,
very anxious about what's ahead of us over the next month.
Some of Oregon's smaller hospitals are overrun as COVID hospitalizations near their previous peak. And a new police team hits the streets in Portland to prevent gun violence. But how is this different from previous efforts? Then later, a Vancouver man's dream to bring thousands of books back to his hometown in Africa.
There's a lot of people who have a passion for reading, just like me as a kid, but they didn't have access to the books the way they wanted to.
Your news starts now.
Good evening on this Wednesday, and thank you for joining us. I'm Laurel Porter. We begin with the proposed change to Oregon's indoor mask requirement. There's a public hearing scheduled for tomorrow morning. The state wants to make the rules permanent, but that doesn't mean they'll be in place forever. Catherine Cook explains why in tonight's Verify.
We've been wearing masks for a long time. Sometimes it feels like forever. And then you see something like this, a proposal by state health officials to make indoor mask rules permanent. It has a lot of people freaking out. But let's stop right there and verify what that does and doesn't mean. In this case, the word permanent is not a literal description of the rule. It's a legal term. It does not mean the rule would be in place forever. It does mean a rule can remain in place indefinitely, that is, without an expiration date, but it can still be repealed. That's important. So why even bother calling it a permanent rule then? Under Oregon law, temporary public health rules, like mask mandates issued by the Oregon Health Authority, expire after 180 days and can't be extended. The current mask rule, put in place last August, is set to expire early next month. That's right after the Omicron wave is expected to peak. Hence, the effort to keep a mask rule in place for now. To do that, state health officials filed the draft rule with the Secretary of State's office last month and is seeking public input. So how long will they keep the permanent mask rule? The filing notice shows state health officials would have the authority to rescind it based on COVID transmission, hospitalization, and death rates. So we can verify, no, a permanent mask rule does not mean masks would be required forever.
The Oregon Health Authority will take public comment on the permanent rule change through Monday. And on Thursday, they'll hold a public hearing. The OHA will use all of the feedback to determine whether changes in the rule language are appropriate. Catherine Cook, KGW News.
So you might be wondering, what about the year-long mask mandate that started in 2020? That was an executive order by the governor. It was not an Oregon Health Authority rule, and that's why it was able to stay in place for a full year. Meantime, millions of people are ordering the in-home COVID test kits from the Biden administration website, mostly without problems. But there are some issues. A small percentage of people say they were not able to order because the computers confused a house with a business or would only issue 4 tests to an entire apartment building. We talked with 2 homeowners in the Portland area who said they were denied and don't know why. Ruth Langlois was thrilled the government launched such an ambitious program, but then she felt a little bit down when the ordering site said her address had already asked for the test kits when it had not.
We should have the best and the brightest working on all of this, and it's a big country too. There's lots, so maybe they. It seems like they would have said it's crashed or something. I think I would have been better if it crashed, but just this fear of the unknown is kind of disheartening.
We also heard about one fake email that looks like the post office email confirming your order. A local woman got it and clicked on it and then got suspicious when it asked for her credit card information. Just a reminder, you do not need to pay for these tests. There is no charge to order them or to have them delivered. And as some of you pointed out, they're not exactly free. It's all being paid for with taxpayer dollars. For the general public, ordering from the federal site is your best bet to get a free test kit, while states and local health authorities have also been working to secure supplies. We've learned most of those tests are already allocated for specific community organizations. Alma McCarty has an update on the supply and One Health Center's work to get tests to communities that need them the most. Alma?
If you've tried to find an appointment for a COVID test, you know that it's a daunting task right now. That's why organizations like Virginia Garcia are ordering at-home tests to help fill the need. It submitted its first order for 13,000 at-home tests a couple of weeks ago and will continue to order more.
I don't see a way that we don't end the pandemic or make it at least endemic without a really strong ability for at-home testing.
Virginia Garcia Memorial Health Center will soon get its first shipment of at-home COVID tests to be given out to patients at its 5 clinical pharmacy sites in McMinnville, Newburgh, Cornelius, Hillsborough, and Beaverton. Hazel Wheeler, the Health and Safety Programs Manager, explains.
We should be getting a pallet of testing kits anytime now. When exactly that is, we're not sure. We know that the order is completed and it's set. It's just a matter of when it actually shows up. And what that really does is remove a lot of the strain that's been at the clinical sites to administer the test. That can now be handled at home. And then when there is an issue with reporting or there's an issue with a positive, then we can have the patient reach out to the providers and if needed, bring them in. That then allows for other care to be provided for other reasons.
Over the last 2 years, Wheeler says Virginia Garcia administered 19,000 PCR tests. The upcoming initial allocation of 13,000 at-home tests will greatly increase testing capacity for a community hit disproportionately hard throughout the pandemic.
Latino and Hispanic population having a significantly higher positivity rate. So in general, for our patients, they're seeing about a 22% positivity rate within the Hispanic population. By comparison, our other patients are only screening at about an 8% rate. And that's, again, over the course of that almost 2-year period.
He said that's reflected in current numbers, showing a positivity rate of up to 45% for the last week.
What that tells you is as you do more testing and you get more positives, it just means there is truly more disease out there and it's just not being identified yet.
The Oregon Health Authority has also ordered 6 million self-test kits. So far, it's received 1.9 million. More than 500,000 went to hospitals, more than 100,000 to schools. And another 500,000, we're told, they're holding back to be able to continue to fill hospital and K-12 orders on demand. Just this week, OHA opened up the order process to local public health authorities and tribes. Multnomah, Washington, and Clackamas County Health Departments all submitted orders within the last 48 hours.
All right, just because these local health departments will soon get a shipment, that doesn't mean you'll be able to go through them to get an at-home test. Once they receive them, they're distributing these tests through community-based organizations to people who live or work in settings that put them at higher risk and those who historically have had a tough time accessing testing.
Thank you, Alma. And at the same time, there's an effort to expand access to the more accurate PCR tests performed by healthcare workers. According to OHSU, it has shut down operations at the Portland Expo Center this week to allow the state to take over the site. The Oregonian reports once that happens Monday, the site will be open 7 days a week instead of 5, and it will offer more tests per day. OHSU will then open 2 new community test sites, one at the Markham Hill campus and a second one at the South Waterfront campus. Both of those locations will be appointment only. OHSU says the 2 sites combined will add about 1,100 more tests for the public each week. And while testing may not be happening at the Expo Center, the site is seeing the return of a major event this week, the Rose City Classic Dog Show. The 5-day event started today with about 20 individual breed specialty shows and an all-terrier group show. Whoa, there's some handsome dogs there. Event organizers are excited to have the show back after it was canceled last year.
It's really a neat dog show because in addition to having all the breeds, and there's almost 200 AKC breeds now, we also have obedience, trick dogs, canine good citizenship, agility. So there's really something for everybody. If you love dogs, most of the people who drop by here are dog lovers.
And just a reminder, mask and social distancing requirements are in place at the event, but how fun to see it back. We're not seeing any relief yet in the number of daily COVID cases reported, and hospitalizations continue to rise. Although this Omicron surge looks to be less deadly, healthcare workers are still overwhelmed. Galen Etlin checked in with hospitals outside of the metro area to see how they're coping.
Candice Macaron is an ICU nurse in Corvallis.
We're doing the best we can.
She loves her work at Good Samaritan Regional Medical Center, but is tired.
More death in our ICU in the last 2 years than we have, in my career.
And with the mounting Omicron surge, she knows the work is not over. Oregon Health Authority reported an average of nearly 8,000 new COVID cases per day since the holiday weekend, up from the Delta peak of about 3,000 last summer. About 900 people are in the hospital, nearing the record set by Delta.
Our intensive care unit is, if not full, nearly full most days and nights.
But it isn't just COVID, it's everything else too.
People held off getting checked out for their heart, and then they had a heart attack, or they have been having headaches and come in and they've had a brain bleed.
Very anxious about what's ahead of us over the next month.
Dr. Doug Merrill at St. Charles Medical Center in Bend says ERs are overrun.
Headed for basically triple their normal volume.
Those are real numbers, and that's a real problem.
Dr. Ralph Yates at Salem Health says his hospital was at 112% capacity last week and is shifting some patient checks to a gymnasium.
We will be doing more of that as we need to.
And even if there is room, Good Sam CEO Laura Henham says there's more to it.
We don't have enough people to provide the care.
Even though there's an empty bed doesn't necessarily mean there's somebody to take care of that patient.
The good news is Omicron appears to be less deadly. OHA reported about 30 deaths in a week of this January, compared to about 250 at the Delta peak. OHA does not record which variant is tied to these deaths, though. The 10 most recent deaths this week were all people 60 to 90 years old, and at least half had underlying conditions. Hospitals also say people who are vaccinated are not ending up in the ICU. So the message is the same. Get vaccinated and boosted, stay masked indoors, and distance for those at risk. At the end of the day, it all helps healthcare workers like Candice Macaron.
I need a little bit of a refresher. I think we all do.
Galen Etlin, KGW News.
New tonight, the push to pass federal voting rights legislation has been shut down. The year-long battle to pass federal voting rights was blocked by Republicans for the 5th time in 6 months. And Democrats say new state laws are making it more difficult to vote in elections. The bill, which needed 60 votes to pass, failed on a 51-49 vote. And we just got an update on a landslide that's had a road closed near the St. John's Bridge in Portland since the beginning of the month. ODOT now says Bridge Avenue will be closed until late March or early April. That means traffic coming from northwest Portland will have to keep going under the bridge and turning around to take the opposite ramp in order to cross the bridge. ODOT says it's going to have to install a mesh system to keep the hillside stable.